Well, hello, everybody. Hello, North Carolina Conference. My name is Kelly Whittick, and I am the Director of Health and Wellbeing here at Wespath. And today we have a special webinar just for the North Carolina population about HealthFlex. Your wonderful staff who's here with us today, Sandy and Joanna, along with Christine, have just shared with the folks at Wespath that behavioral health is something that is very important to folks in North Carolina, and it's an area of concern. And so we wanted to make sure that we took some time to share a little bit about how your HealthFlex plan really covers behavioral health benefits and supports individuals in their behavioral health journey. So that is the purpose of this webinar today. So welcome and thank you for joining. All right. The first thing I want to do to kick this off is share this link to the Wespath Clergy Wellbeing Survey. And this sets a little bit of context for why we find it so important to host good emotional well-being and mental health benefits within the HealthFlex plan. So if you do have a phone and you want to snag this QR code, you can look at the results of the survey. I am going to show a highlight specific to emotional well-being. But Wespath does this survey every other year. We did it in 23. We'll be doing it again in 2025. And we've been doing it for over a decade now. And we used a statistically significant sample. And so we really feel like this information is generalizable to the overall clergy population in the United Methodist Church in the US. So when we look at some of the results, looking at results from 2013 and comparing them to 2023, we can see that there's really been a significant decline in various metrics that we would consider functional difficulty from depressive symptoms. So not necessarily a diagnosis of depression, but experiencing symptoms in your life that are consistent with depression or depressive symptoms and having them actually impact your function. So if you look, feeling tired, low energy, difficulty sleeping, overeating or undereating because you're not hungry, low interest, low pleasure in doing things, or feeling down and depressed to the point where you have difficulty concentrating, all of these have gotten significantly worse in the clergy population over the last decade. In addition to that, in this survey, we compare the results of the UMC clergy with a matched benchmark, like a demographically matched benchmark. And our clergy have been sharing that they are experiencing these things at more than twice what we consider the national average in a benchmark. So overall, we know we have a problem with well-being, with clergy well-being, and specifically with emotional well-being. So therefore, HealthFlex, the plan, the active benefit plan that Wespath offers and that North Carolina sponsors, for a very long time we've said, hey, we need to make sure that this plan covers behavioral health benefits as best as we possibly can. We need to limit barriers to behavioral health care. We need to expand access to behavioral health care. And so there are a lot of things we've put in place to do that. And I'm here today to share some of those with you. Let's start by reminding ourselves kind of what the different plans are in HealthFlex, because these are the plans that we'll be talking about today. So some of you may have seen this slide before, but this shows all the medical and pharmacy benefit choices, all the dental, the vision, and the various health and reimbursement account options. Now, when we're thinking about behavioral health, we're really thinking about those medical and pharmacy plans. However, I left highlighted the health accounts because when you do have out-of-pocket costs for behavioral health services, you can use your health savings account, your health reimbursement account, your flexible spending account to help pay yourself back for your costs. And that can be a really good way to kind of manage some of the cash flow issues that can come with behavioral health. But for the most part, it's this top line here. What are the different plans you can choose that cover medical and pharmacy? And certainly with medical is included behavioral health, and that might be the outpatient therapy that you get, the inpatient care that you might need, intensive outpatient, partial hospitalization. That's all included in the medical benefit. And then on the pharmacy side, there are certainly very important behavioral health and mental health medications on the pharmacy side that are also covered by HealthFlex. All right, just a quick refresher. We are coming up to annual enrollment, and so we want to make sure that everybody kind of remembers, how do these plans generally work? So all of our plans have a deductible. And so typically there are a lot of services, particularly inpatient services or outpatient hospital services, that are subject to the deductible first. Once you've met the deductible, which might be different depending on which plan you've chosen, then you're in this co-insurance phase. So that's the phase where you pay a percentage, and the plan pays a portion or a percentage. And so depending on which plan you've elected, that co-insurance might be different, and you might pay a different portion. During that deductible co-insurance phase, you can always use your health account. So you can use your health savings account, your flexible spending account, your health reimbursement account to help pay for your share of the costs. Once you hit that out-of-pocket maximum, and this is for all covered expenses, so anything that's covered and allowed, after you hit that out-of-pocket maximum, there's no more cost share. So now the plan will pay 100% of any covered expenses. The out-of-pocket maximum is the same for every plan, every HealthFlex plan. So individuals need pay no more than $5,000 out of pocket. A whole family would pay no more than $10,000 out of pocket. That's the same regardless of which plan you've selected. Now, co-payments, which actually come into play with one of our plans with behavioral health, that can be due either in the deductible phase or the co-insurance phase, but not after the out-of-pocket maximum has been reached. So you might have met your deductible or not met your deductible. If you have a co-payment for a medication or a behavioral health visit, that applies until you hit your out-of-pocket maximum, and then you no longer have to pay that co-payment. But your co-payments don't count towards your deductible, but they do count towards your out-of-pocket maximum. And of course, non-covered expenses and dental and vision expenses do not apply to the deductible or the out-of-pocket maximum. Okay, so this is true for all the plans. Now let's dig into the different types of plans. So as we saw a few slides ago, we have 6 different plans. There's the B1000, that's in the orange category. There are HRA plans, so that's the blue column, and that's our C2000 and our C3000. And then we have HSA plans, and those are qualified high deductible plans. You can contribute to a health savings account if you're enrolled in them, and we have 3 of those, the H2000, the H2500, and the H5000. All right, every single one of these plans, all 6 of them, you can see whoever you want, whatever provider you want, in or out of network, the provider of your choice. You don't need a referral. These all are PPO plans. You don't need a referral to go see a counselor or a therapist or a psychiatrist or a psychologist. You can choose your provider. You do have access to the same broad nationwide Blue Cross Blue Shield PPO network in every single one of these plans. So it's the same network. It is the Blue PPO network, which is the broadest Blue Cross network that's available. In North Carolina, you might have Blue Cross Blue Shield of North Carolina. We contract in Illinois, and that's fine. You still have access to all those North Carolina Blue PPO providers. All right, here's a big one. Number 3, out-of-network outpatient counseling. So if you're seeing a therapist, if you're seeing a psychologist, a social worker for outpatient counseling visits, those are covered at in-network levels. This is a really big deal and something that we put in place several years ago because we didn't want clergy or their families or lay employees of the church to feel limited and restricted by networks. And so this is true regardless of which plan you choose, that HealthFlex will pay for your behavioral health visits, your outpatient behavioral health visits at the in-network level, even if your provider isn't in the network. We cover the same services, the same medications, just different amounts, different cost shares in the different plans. And then every one of these plans includes a robust selection of well-being programs and incentives, and many of those are focused on emotional well-being. So a very thorough set of benefits in every single plan, regardless of which you choose. Now let's talk a little bit more about that broad nationwide Blue PPO network. It provides pretty solid access to providers throughout North Carolina. But whenever it comes to behavioral health, you're subject to issues like nationwide shortages. There are not enough mental health providers for all of the mental health needs in this country. And many behavioral health providers choose not to participate in networks at all. They might be only self-pay. That's just what they've chosen. And so despite having a very broad network, we could have areas where it's like, hey, it's hard to find a provider that's in network who's taking new patients. And that's not really a Blue Cross issue specifically. It's really a nationwide provider shortage issue. That is why we offer that same benefit level for outpatient counseling, whether your provider is in network or not, because we know that there's a nationwide shortage of mental health providers, and we do want to make sure that people have access to outpatient counseling if they need it. That's not to say that there's not a benefit to seeing an in-network provider if you can find one. So if you're not already seeing a provider, it makes sense to work with your care coordinator, try to find somebody who's in the Blue Cross Blue Shield network who's accepting new patients, because you actually get a lower contracted rate. A lot of out-of-network providers are billing very high rates that are beyond what would be considered a contracted allowed rate that an in-network provider would be allowed to charge you. And if you're in an HSA plan and you're paying the full discounted amount until you've met your deductible, having that discount actually helps you save money. So for example, our family sees a therapist, actually a couple members of our family see therapists, and the billed rate might be, I think it's like $140 for a 45-minute visit, but the allowed rate is down to $80, which means Blue Cross discounts it and we're only allowed to be charged $80. So that matters. Some out-of-network providers may charge even more than that. You may charge a couple $100s, and they can do that in certain areas, and we will cover it. But it does increase the out-of-pocket cost to you. So there's definitely a benefit to seeing an in-network provider. Additionally, the in-network providers are required to submit the claims on your behalf, and they can only charge you your share, whereas an out-of-network provider can charge you the full amount and then make you responsible for requesting reimbursement. So from a cash flow issue, that can be a burden. So definitely better if you can find an in-network provider to go for it. Now, HealthFlex also offers MD Live behavioral health. So that's in addition to whatever you can find in your community. There's access to virtual mental health care ongoing through MD Live. And so that can be a psychologist, it can be master's level counselors, it can even be a psychiatrist. So you can do evaluation and management by a number of different mental health professionals. Sometimes it means you can get an appointment quicker than you'd be able to get in your community. It could be a stopgap. You could be like, okay, I'm going to go to MD Live until I can get an appointment with somebody in my community. Or it can be a permanent thing. You could say, I'm just going to do the virtual thing. I don't feel comfortable going in the community. I don't feel like comfortable parking in this parking lot. And my parishioners potentially can see that I'm getting counseling. Not that they should be judging that, because they should probably be getting some too. We all can benefit from counseling. But with MD Live, there's always somebody who's taking new patients. There's always somebody who's going to have an appointment, and you can keep seeing that same provider. And through 2024, HealthFlex is actually paying 100% of MD Live services. We would love to be able to continue that in 2025. Currently, Congress has not extended the permissions that allow us to do that for all plans. So we're just kind of gonna wait and see. I'll share a little bit more about what the costs will be for MD Live in 25. But in 24, take advantage of this. If you're looking for mental health care, we are still paying 100% of the costs for MD Live virtual behavioral health. And then we have just various well-being programs that really focus on mental health. And these are important too. There's a lot of ways to focus on your mental health. And so some of these we have through Virgin Pulse, which actually is, you've probably gotten an email, it's going to become Personify Health in 2025. There's a variety of ways to track like healthy behaviors related to emotional well-being. Like if you're trying to, peacefully meditate at the end of the day, or carve out some time, to just take deep breaths or use other various tactics to support your emotional well-being. You can track those on Virgin Pulse. You can get ideas through the journeys for various activities that you can do to improve your mental health. You don't actually even have to talk to anybody if that's not your thing. So that is one way that you can use the well-being programs to boost your mental well-being, your mental and emotional well-being. We also have health coaching through Virgin Pulse in the future, Personify Health. These are certified professionals who can help you meet well-being goals. One of the coolest things about health coaching that we've seen over the years is that it actually boosts emotional health, reduces stress, and boosts emotional well-being as measured by our health check. So that's exciting. Just knowing that you have somebody who's partnering with you and working with you on your well-being goals is something that can reduce your stress and boost your emotional health. So that's a great program. And then we have our employee assistance program. So this is an entirely different program in addition to being able to see whichever provider you want through your medical benefit. In addition to being able to access the MD Live virtual providers, the EAP actually offers 8 visits. They can be virtual or in person, and you can access them each year per issue. So if you have some job related stress at the beginning of the year, and then you maybe have some grief from the loss of a family member later in the year, each one of those issues, you could get 8 new visits. You can also use it for anybody in your household, even if they are not covered by HealthFlex. So a great benefit that you can use to kind of really help anybody who lives in your household, 8 no cost visits. So definitely encourage people to take advantage of that, especially if it's a short-term need, right? Like if you know you're going to need long-term counseling, it may make sense to get started with an MD Live counselor or a local professional. But if you think it's like kind of a discrete need and you might be done in 5 to 8 visits, then this is a great way to access no-cost services. So I'm going to show you another QR code. So this is one if you want to scan it. So this is a tool we actually developed to help walk people through the different behavioral health benefit choices in HealthFlex. So if you're not really sure where to start, you're like, I'm pretty sure I want to talk to somebody or do something, but I don't know what's right for me. This tool kind of walks you step by step and points you in the direction of different benefits that are available to you through HealthFlex. So definitely encourage you to take a look at this tool. All right, so that's what's similar about all the plans when it comes to behavioral health. Now let's talk a little bit about what's different about the different plans. When you're, like I said, you're coming up to annual enrollment, how do you know if you're picking the right plan for you based on whatever behavioral health needs and other needs you may have? So in our HSA plans, so those are the 3 plans that start with H, the H2000, the H2500, and the H5000. Individuals have to pay the full discounted amount of the visit if it's in network, or the full cost of the visit if it's out of network, until the deductible is met. And if you're in the H5000, your deductible is basically your out-of-pocket maximum. So you're going to pay the full discounted amount or the full billed amount until you've hit that out-of-pocket maximum. So that's a requirement by the IRS. That's how high deductible plans work, the HSA plans. So that's not something that we really have the flexibility to budge, but that is the way that those HSA plans work. Now, remember, everything counts towards your deductible, and a lot of people aren't only getting behavioral health care, but that is how the HSA plans work. The HRA plans, almost everything is subject to the deductible, but mental health care, outpatient mental health is the exception. So if you're in an HRA plan, that's our C2000 or our C3000, you don't have to meet the deductible and you go right straight to coinsurance. So the C2000, you pay 20%, the plan pays 80%. And for the C3000, it's a 50-50 split. And again, that's based on the discounted amount if your provider is in network, or the full billed amount if your provider is out of network. Now, the B1000 has a fixed copayment. It's $15, per visit, regardless of whether you've met the deductible or not. Obviously, that $15 copay stops if you've met the out-of-pocket maximum, and that $15 does not apply to the deductible. I did want to bring up medications because mental health medications are often extremely important and part of how we keep our chemistry in a way that allows us to maximize our mental health. So in the HSA plans, unless your drug is preventive, which some antidepressants and other mental health drugs might be preventive, in which case you want to check out the preventive drug list. But if your drug is not preventive, then you are responsible for the full costs of the drug until your deductible is met. But if your drug is preventive, you go right to that co-insurance or co-payment. And then in the HRA plans and the B1000, it's always either co-payment for a generic or co-insurance for a brand drug. All right, I want to dig in a little bit and give you some actual examples about how much mental health care might cost under our different plans. So I have all 6 of our plans here. Our 3 H plans are to the left, and then our 2 C plans, those are the HRA plans, and then our B1000 is on the far right. So this is an in-network person, an in-network provider, and it's an outpatient behavioral health office visit. And it could be a psychologist, it could be like a master's level counselor, social worker, therapist, etc. And this is an average visit cost. And I like I shared, this is similar to what my family is seeing. So, the in-network provider bills $140, and then Blue Cross discounts it down to $80 a visit. So in an H2000 plan or an H2500 plan or an H5000 plan, until you meet the deductible, you're going to pay the full $80. Not $140 because you get to benefit from the discount, but the full $80. And then once you've met the deductible, in the H2000, you'll pay $16 a visit. In the H2500, you'll pay $24 a visit. And in the H5000, you would no longer pay because you'll have met your out-of-pocket max. In the C2000 and C3000, you don't have to meet your deductible first. So in the C2000, you'd go right to that 20%, which is $16 a visit. And the C3000 is 50%, which is $40 a visit. And then in the B1000, it's always $15 a visit until you hit that out-of-pocket maximum. So there's a lot of variety here, and I don't want to diminish, when you're paying weekly $80, that adds up. And so you really want to consider that and think about, which plan is the best fit for you. All right, now let's look at an out-of-network behavioral health office visit. And now I'm saying, okay, since there's no discount, let's just assume that that's $140, no discount. But it doesn't mean that it's definitely $140. And there are definitely some out-of-network providers who charge more than $140. HealthFlex will apply the plan design based on the billed amount. So that is absolutely in your benefit. But until you hit that deductible for the HSA plans, you are going to pay that full billed cost. So in the H2000, you would pay that $140 a visit until you met the deductible, and that's true for all of the HSA plans. And then once you've met the deductible, you'd pay 20% in the H2000, which is $28. You'd pay 30% in the 2500, which is $42. And then you wouldn't pay anything in the H5000 because you've met the out-of-pocket maximum. And then in the C2000, you would not have to pay the full discounted amount until you get to your deductible. So you would just pay $28 a visit in this example. In the C3000, you're paying half, so $70 a visit. The B1000, again, always $15, which sounds great, but remember, you're also paying a lot more in premium each month to be on that plan. Another important thing to remember with these out-of-network behavioral health visits is that they are not required to submit it on your behalf, which might mean that they will charge you and then you will have to wait for reimbursement to get reimbursed. I have another slide later that talks about this, but it can take 4 to 6 weeks for a reimbursement. And so we absolutely recognize that that can be a really long time to wait for reimbursement. If you're seeing a therapist every week and it's $140 and it takes 6 weeks, it's like $800, $900 that you're kind of floating. And so that can be a lot and that can be prohibitive. But we felt like it was important to offer this option where you can get the plan to reimburse you for the out-of-network behavioral health services so that you can truly choose which provider you want to see. And then this is the MD Live behavioral health visits under the different plan. Now remember, in 2024, so you still have like 2.5 months of $0 cost, no copay, no coinsurance. HealthFlex will cover the whole thing. And I will tell you that if Congress ever allows us to go back to that, we absolutely will do it because it's our preference to be able to offer as much access to behavioral health care as we possibly can. But in January, the regular plan designs will apply. So a 45-minute psychotherapy visit, like with a counselor or a PhD psychologist, their billed amount is $92. So you would pay in the H plans, you would pay the $92 until you hit your deductible, and then you would pay the coinsurance amounts. And I have to apologize for that H5000. Once you hit your out-of-pocket max, that's a zero, so you don't have to pay anything in the H5000. And then in the C plans, you don't have to meet your deductible first, so you just pay those coinsurance amounts. In the B1000, always $15. So remember, the big takeaway here is that the same benefit level applies whether your provider is in network or not. But if you go to an out-of-network provider, you may have to pay upfront the full billed amount while you're waiting to be reimbursed. I do want to share that most people in HealthFlex will save money in an HSA plan, but not everybody will. So this is an analysis that we've done, and we do this annually. And when we looked at 2023 claims across all of HealthFlex, so thousands of people, thousands of permutations of claims, we see that the vast majority of people fall into this blue or the green category, which means the best plan for them financially is the H2500 or the H5000. And that's because the money that they save in premium more than offsets what they spend at point of service. Very few people are best off in the C2000 or the B1000. On average, we see a lot more people choose those plans, and that's fine because cost isn't the only factor in choosing a plan. In the HealthFlex average for 23 and 24 here. In North Carolina, you actually have an even higher percentage who have chosen those two lowest cost plans. You have about 36% in the H5000 and about 22% in the H2500. So you have more than half in those plans, which can be a great decision. And it may mean that folks are saving a lot of money, but it might mean that we need to make sure that people are planning for how they're going to pay for the expenses, while they're waiting to be reimbursed or while they're waiting for money to go into their HSA. So we have Alex. Alex Benefits Counselor is the tool, and I have the North Carolina link for 2025 right here below. It includes all of the information about the plan premiums for your different plans in 25, as well as the premium credits that are available to you through the conference. It only takes 30 minutes to go through, but I actually went through Alex in sort of a unique situation. I said, what if I'm only going to get weekly outpatient counseling and nothing else? Not one medication, not one other doctor's visit, not one ER visit, just everyday outpatient counseling. Or not every day, sorry, every week. And I actually went through this, and they said that Alex said the C2000 is the best plan for me. And I can understand why that would be the case, because in the C2000, you don't have to meet the deductible first, and the plan pays 80% of every visit. So all you're paying is 20% of every visit every week, right? You don't have to meet the full deductible and pay the $80 or the $140. You're just paying that, that $16 a visit. So if you look at the Alex illustration here, the blue shows how much you'd pay in premium. The green is how much anticipated out-of-pocket costs. But I do want to point out the red, which is the worst case scenario. So let's say that you thought that you were just going to end up with one behavioral health visit a week, but you ended up having something bigger happen. You can see then in the C2000 and the B1000, the worst case scenario is actually $2,000 to $4,000 more expensive for the year than the H5000 and the H2500. But if you truly only are getting one behavioral health visit a week, you may end up saving money in the C2000. And you probably save about $700, $700 or $800 for the year. But if you're getting any other care, then sometimes those lower cost plans end up being better off for you, because everything is contributing to the deductible. So that's why we encourage you to use Alex to try to guess what you actually think is going to happen for you and your family in a given year. But you can see here how you could end up saving money in the C2000 or the B1000 if all you get is outpatient behavioral health visits. But most of us don't just have outpatient behavioral health visits. We have other things that happen too. And so if those are the case, then you're going to end up maybe better off in the H plans, just like the vast majority of HealthFlex. And don't forget that in some plans, there's an HSA or HRA contribution that comes with it. All right, so this is just an example, just an illustration, encouraging you to use Alex. I do want to spend a little bit of time talking about, is a health savings account plan a good plan for you? And I think it depends. I think that most people will save money in an HSA plan, in a lower cost HSA plan. And that is when you include the premium, your share of the premium, plus how much you put in, how much the plan gives you in the HSA, plus whatever out-of-pocket costs you have for care. But you have to adopt strategies to manage your cash flow in the meantime, right? Because you are going to pay more for the services that you get. And if you're not ready for that, it can feel really bad, especially at the beginning of the year. So remember, out-of-network claims, including out-of-network behavioral health, those are paid up front by you and then reimbursed after the fact, and that can take 4 to 6 weeks. So you have to have a plan for how are you going to cover those expenses until you're able to be reimbursed for them. I encourage people to use your health savings account. Maybe use a payment plan with the provider. Some providers allow you to go on payment plans, and you could say, hey, I'm going to have way more money in my HSA at the end of the year. Like, could I, pay a little bit less or have a payment plan up front, and then, I can cover it more thoroughly at the end of the year. Also, making sure that you're contributing regularly to your HSA is key. So, every month I'm putting money in my HSA. So then when our behavioral health co-insurance or deductible payments come through, I have money in my HSA that's ready for that. And I don't really feel like I'm fronting the money because it's there in my HSA. It might mean, especially if you don't have a ton of money in your HSA at the beginning of the year, it might mean taking a look now and seeing, okay, well, if I haven't contributed all the way up to the limit, do I have some extra that I could put in the HSA now in 2024 at the end of the year that will help me have a bigger HSA balance at the beginning of 2025 that will help me cover some of this cash flow issue until I get reimbursed. So just something to think about. It obviously doesn't work for everybody. Some of you may have already maxed out your HSA contributions, but just a consideration. And then do consider low or no cost options where available. So right now you have MD Live at $0 through the end of the year. You have your EAP, 8 visits per issue per year at $0. It is a different network. It's it's a more restrictive network, but if this is a problem and it's a barrier, then use one of the other services that are available to you. I do want to acknowledge and also applaud the folks in North Carolina for really using the behavioral health services at a much higher rate than we're seeing the general HealthFlex population use it. And that's most seen in the primary participants. So the dependents and the spouses are using it at a similar level to what we see throughout HealthFlex, but your primary participants, your clergy and your lay employees are using behavioral health services at almost double the rate of a standard HealthFlex participant. So I just want to applaud you for that, and I want to acknowledge that it's clear that you're prioritizing your mental health and you're making you're making the effort to see somebody and to kind of maintain that mental health and improve that mental health. And I think that's amazing. I hope that because of that, I hope that folks, I'm glad you're joining. I hope that you share this with others who may have missed it so that they can truly understand what's available to them, because clearly it's something that's important in North Carolina. And I do want to just emphasize one more time, if you love your out-of-network mental health provider for outpatient counseling, we will cover it at in-network levels. It does require extra work and a little bit of patience on your part. So my next section is just to try to make sure that you understand how to submit those out-of-network claims. All right, and this we're going to share. We're going to share with the recording. The link for this, the PDF for this, as well as the slides. We'll also make sure that your conference office has them available so that they can maybe post them with the recording. But anyway, if you're seeing an out-of-network mental health provider or any out-of-network provider, but specifically a behavioral health provider in 2024, there is a 2-page PDF. One has a claim form and one has the instructions on it. And so we'll make sure that we share that with this webinar recording. But you need to submit the claim form, an itemized bill, and a paid receipt. And you're going to submit it to this email address. And if you're not sure that you have everything filled out correctly, I strongly encourage you to run it by your care coordinator. You can put it in a secure message to the care coordinator and you can say, hey, did I fill out this form right? Do I have all the information I need? Because you need to have your name on the receipt. You need to have exactly what services, how long the services were, the name of the provider, information about like the provider's address, etc. All needs to be on the receipt. So you can't just, scribble, Dr. Smith, $80. It can't just say that. It has to be like, okay, Dr. Smith saw Kelly Whittick for 45 minutes on this date. It was for, psychotherapy, and here's the amount. So that all needs to be included. And then it can take 30 to 45 business days to process. So it can be a long wait when you're putting out that money. Making sure that you have all the information that you need is really critical. And if you're not sure, we strongly encourage you to ask your care coordinator for help. Now, what if you are somebody who did not realize that we have this generous out-of-network benefit and you had all these out-of-network expenses last year in 2023, and now you're just realizing that you could have been submitting those for reimbursement? Well, we will give you through the end of November of this year to still submit those 2023 claims. You can use the same claim form, but this time we're just going to ask that you send the claim form and the bill and the receipt to Wespath, and you can send it to activeteam@wespath.org. And we will get it onto Blue Cross to make sure that they process it at the 2023 claim level. If you've already met your deductible in 2023, like that would already be counted. If you've already met your out-of-pocket max in 2023. However, the end of November is going to be a firm deadline for 2023 claim submission. So dig those up and let's get them into Wespath so that we can help you get reimbursed for your out-of-network claims in 2023, because the HealthFlex plan does cover out-of-network outpatient behavioral health at the same level as inpatient. In-network, sorry. All right. Well, that is all I officially have today. And I do just want to share that emotional well-being, it really matters to Wespath. It matters to me. It matters to my team. Like, this is an important piece of the HealthFlex plan. And so we just are really strongly encouraging you to make sure that you thoroughly understand all the well-being or all the emotional health benefits that you have through HealthFlex, and that you're really using them to the absolute fullest. So I thank you for joining me today. I thank you for your attention. And I do have a little bit of time for questions if anybody has those. Let's see. All right, so a couple of questions. One is, what do we mean by in-network level? When I say out-of-network benefits are at the in-network level. So normally, like, let's say if you go see a doctor, like a cardiologist, if you see an in-network cardiologist, there's an in-network deductible. In the H25 or the H2000, that's $2,000 for a single and $4,000 for your family. But if there's an out-of-network deductible that's double that, because we strongly encourage you to see in-network providers. But When it comes to outpatient behavioral health, that is treated in like it's an in-network. So it's only subject to the in-network deductible. It's only subject to the in-network out-of-pocket max, and you get the in-network coinsurance, even though your provider is out of network. And that's true for outpatient mental health counseling visits. So again, that's a really unique benefit. You pretty much aren't going to find that anywhere else. And Wespath does it because we feel like it's so important, and we know that emotional health is so important to the church and to clergy in particular. Does your behavioral health service costs count towards the deductible? And the answer to that is it depends. So if you are in an H plan, so an HSA plan, then you have to pay your deductible before the plan starts paying for mental health. And so in that case, the amount that you pay does count towards your deductible as well as your out-of-pocket maximum. But in the C plans and the B1000 plan, you do not have to meet your deductible. The plan just kicks right in and starts paying coinsurance, or you pay the copayment. And in those plans, it does not count towards your deductible. It only counts towards your out-of-pocket maximum. All right, what else do we have? How do you know how much you should put into your health savings account? It's a great question. I will tell you that if you can maximize your contribution to your health savings account, you should do that. Because remember, a health savings account, it's your money. And if you don't use it this year, it just rolls over to next year. And if you have enough extra, you can use the investment options, and you can kind of just permanently save it for, healthcare costs and retirement. I try to make my goal to contribute $1,000 more than I'm going to need every year, and then take that money at the end of the year and put it into an investment account within the HSA, so that over time that grows, and I'm using it for future healthcare costs. EY is a great resource to ask in terms of how much might you want to strategize to put in your HSA. And Alex is another great resource. So if you go all the way through Alex and you tell Alex you're going to choose an HSA plan and how much you're expecting to need in various medical and pharmacy services, Alex will give you an estimated amount to contribute to your HSA. And if you can afford more than that, then put in more than that, because again, that money is triple tax advantage, and it's a great way to save money for the future and future healthcare expenses. All right, here's another great question. How do you contact your care coordinator? You know that Blue Cross ID card that you get from HealthFlex? You just flip it around, and the number on the back is your Wespath care coordinator. So all you need to do is find your ID card, and it's right there. Another option is to log into benefitsaccess.org at the Wespath site. And then if you go to health, there's a link that says medical benefits and care coordination. You can click that, and you'll go to the website with the care coordinator. It has the phone number up there. You can secure message your care coordinator. So there's a lot of ways to reach your care coordinator. All right, one more question I have is just really kind of a comment about the behavioral health network and feeling like it's not sufficient. And I hear you on that. I think that it goes back to that idea that, mental health providers in general are in short supply. And many of them choose not to join any network. From a health benefit standpoint, we have to have a network to really be able to take advantage of most affordable healthcare. But when it comes to this benefit, that is why we choose to offer the outpatient counseling at the in-network level. Or I'm sorry, the out-of-network outpatient counseling at the in-network level, is because we agree we would like to have a broader network. We can't have a broader network, so what we're going to do is say we will give you the same generosity of benefit regardless of whether your provider is in-network or not. One more comment is just a comment that it feels like it's too long that it takes too long to reimburse an out-of-network claim. And I agree. It does take too long. If I could make it shorter, I would. You have my word that Wespath is advocating on your behalf with Blue Cross Blue Shield to try to shorten that time frame because we would like that to be less of a barrier to people seeking mental health care as well. Right. Well, if nobody has any other questions, then I'm going to thank you for your time today. I hope this was valuable information. And as always, Wespath is very grateful to serve you. And I promise that we do really feel as strongly as North Carolina that that mental health benefits are important and a very big value to have in a health plan. And we are constantly striving to have the best behavioral health benefits available in HealthFlex. So thank you and have a wonderful day.